I just wanted to welcome everyone to the PT versus PT discussion. We'll be talking about like similarities and differences with personal training and physiotherapy, and we're going to hopefully debunk some myths and stereotypes. And any questions you have, leave them in the comments below, and then we'll answer them after. So my name is Simone. I'm a certified personal trainer as well as a virtual personal trainer. My Instagram is Simone's Fit Fun Life.
And my name is Veronica. I am a registered physiotherapist, and my Instagram is Velox Rehabilitation. So thanks for joining us, guys. Welcome. We're really happy to be doing this because we've gotten a lot of questions about this. And sort of just a little heads up of what we're going to be talking about. Every personal trainer and every physio kind of have different approaches to things. So what we're going to be talking about here is going to be very specific to the way Simone works, the way I work, and the way Simone and I work together.
Exactly. So before we get into it, I guess let's just talk about how we met.
Yeah, so I heard all about Simone through one of my patients. She hyped up Simone so much that I was like, I have to meet her. And eventually we did get to meet. Simone booked an appointment to see me.
Yeah, and basically from there, I have this like rare condition. It's called osteitis condensus iliac. This kind of affects my lower back. So my client mentioned her and how great she was. So I said, you know what, let me go see her and to prevent any flare-ups and any future problems. So she prescribed me some exercises to do, and she came highly recommended from my client. So I was super happy to see her, and I was doing figure skating at the time. So she helped me like avoid having that pain and just told me the things I should be doing, maybe should be avoiding. And she really assessed me and gave me really good corrective exercises, like rehab exercises. She really knew her stuff, and I could tell that right from the jump. So it was beautiful. It was amazing.
Thanks, Simone. So a little bit more background of kind of like us working together. So like from there, we did lose touch a little bit,
Yeah.
but then we reconnected through Instagram. So I had a couple of patients that I was seeing, and they were asking about personal training, and I thought, you know what, Simone is the absolute, like they're a perfect fit together. And then kind of vice versa too. Simone had some clients that she was like, you know what, Veronica would be a really good fit. They'd be a really good fit together. So ever since then, we've been friends, we've been talking fitness, and we've been talking about how to help clients. So one of my favorite things about us reconnecting is the fact that how well we work together. So we both collaborate, right? Like we're trying to help our patients / clients reach their goals. So actually almost weekly, Simone and I have been chatting. We talk about kind of like their patients, their progress, how we can maximize their treatment programs, their plans, just to help everyone reach whatever goals they want to reach, right? So it's been so cool working together, and I have to give you all the credit as you were the one that came up with the idea.
Yeah, but you're part of this beautiful collaboration we have too. So obviously all the credit goes to you, and you taught me a lot as well. And yeah, I came up with the idea because I had one client tell me like, oh, Simone, I don't need a physiotherapist. I have you. And it just didn't really sit well with me because I know there's benefits, from seeing a physiotherapist as well, because you guys have a little bit more in-depth knowledge. And, personal trainers know the muscles and the joints as well, but you guys just go a little bit deeper. It's like a whole other level compared to personal training, which brings me to my next point. Physiotherapists have far more in-depth knowledge on the muscles and the bones. And I think you guys even have to take a national exam. Is that correct? I heard it's really difficult.
Yeah, so we have a two-part exam. So the first part is written, and then once you pass the written exam, then you can practice as a resident physio, and you have to practice under a mentor who's worked for a couple of years. Then once you pass that and start working, then you have a 6-hour long practical exam that takes you through a whole bunch of different scenarios that you could come across as a physiotherapist. Very nerve-wracking, very difficult, but once you pass that, then you become a registered physiotherapist. And now I want to know a little bit about how did you become certified?
Yeah, so I'm actually certified through ACSM, which is American College of Sports Medicine, and I also did my fitness and health promotion diploma at Humber College. So, with personal training, you can do a weekend course, you can do an online course. You don't even have to do practicals with some of the certifications. And that's what makes personal trainers so different sometimes, is some of them have more in-depth knowledge because they've taken, other courses, maybe went to university, college, and then maybe one has just done like an online course. And at the end of the day, anyone can become certified. You have to become certified to practice. But to be a great personal trainer, it definitely takes a little bit more work. And we need to know a little bit more than just the basics like flexion, extension. But we don't also get into the deeper muscles of like the back or the joints. At least I didn't when I was studying personal training. So yeah, anyone can be a personal trainer, but it's about, you know, how hard you work to be the best personal trainer. So a question about physiotherapy. As a certified personal trainer, we have CECs, which is continuing education credits. So which means you have to take a certain number of like courses in order to get these points, and then that'll allow you to recertify to be a personal trainer again. So do physiotherapists have anything like that?
So we don't call them CECs per se, but the College of Physiotherapists does expect us to have a certain number of education hours per year. So that can be through courses, that can be through reading research articles, through study groups, and I try to get a little bit of all of that in one year.
Hmm. That makes sense. Um, yeah. Okay. So something many personal trainers would love more of, and I think you guys have it a little bit, is the regulations. Not even a little bit. You guys are regulated. So if someone goes to a doctor, let's say, and they have like a shoulder rotator cuff injury, they can get recommended to see a physiotherapist. Now, if someone's overweight and they go to the doctor, a doctor's not going to say, you know, I'm going to recommend a personal trainer, which is unfortunate. And I would love it if our field got regulated a little bit more. So not to say that we could weed out the personal trainers that maybe aren't as educated or could be doing things a little bit better or differently, but just to allow our field to be more recognized as part of the health and fitness realm of things to do and things to try on your health and fitness journey. So yeah, that would be nice.
No, yeah, so yeah, it's true. Physio is a regulated, there's a College of Physiotherapists of Ontario, but I totally agree with you. Like, I think your profession, like regulating your profession would be a phenomenal idea. And I do think that that would weed out kind of like, you know, you would have, you know, the mediocre personal trainers to the great personal trainers, right? So like for the longest time, I felt like I didn't really have anyone that I could refer patients to until I met you. I've had a lot of patients tell me, you know, like I'm never going back to a personal trainer again because they're the reason why I'm in pain, right? And but you have such a vast knowledge and you help people when they're in pain, right? So do most people know that personal trainers can still help people even when they're in pain?
I feel like most people don't know because I have trained clients who've had knee replacement surgeries, MS, scoliosis, back pain, fibro, you know, you name it, right? But I will start off by saying, like, in the beginning, I wasn't an amazing trainer. Everybody has to improve, right, over time. So I made some mistakes here and there. But my job is a lot more than just getting the gains and focusing on like getting big muscles. It's also about making sure that the body is like a strong, solid foundation so that when you do add load, the structure is strong. So of course there are certain things that, you know, you shouldn't be doing and that are out of my scope of practice. And that's why I refer clients out. Like that client I referred to you to, you know, do physiotherapy before they saw me. So it's
Mm-hmm.
definitely, you know, a little bit different.
Yeah, no, and kind of like you were saying too, likewise, I like to refer patients over to you that I feel like if a client needs more of a structured, organized weight loss program or a strength organized program. And I know that you studied nutrition as well, which is so important for overall just well-being. I feel like a huge stereotype is that a lot of people think that they should only come to see me if they're in pain, and they should only see you if they're not in pain.
Yeah, which is not the case at all. Like personal trainers can also see clients when they're in pain or want to prevent further injuries. And clients I've referred to see such benefits and relief. And our mutual clients love that we're working together and to help them with their overall health and goals. Because it's like we're a professional team. Like we're all just like working on their health and wellness. So now should clients and patients see you when, you know, they're not in pain? That's a question that a lot of people have asked as well.
Yeah, so a huge role in physiotherapy is actually the prevention of pain, which a lot of people don't know about. So just kind of like a couple of examples, like if someone is starting a new job and it's going to be a very physical job and they're worried about will their body be able to handle this new physical job, then coming for physio for prevention is an absolutely great idea. Also, if there's a patient who gets reoccurring back pain, so every year they get this back pain, you can come see me during the time that you don't have the back pain, um, to make sure we cut that cycle and you don't get back pain for the next 20 years. Or even like an athlete, for example, who is going to be starting a very important season coming ahead. Scouts are going to be coming to watch them. They want to make sure they don't get injured. So you can come and see physio, figure out your strengths, figure out your weaknesses to make you the best possible player, right? So it's the same thing for personal training, right?
It is, yeah, exactly. So, like I mentioned before, personal trainers also help clients to prevent injuries. And, like, for instance, I had a client who had a broken ankle and she was seeing a physiotherapist, and then she stopped seeing her after her benefits ran out. And, you still got to continue the exercises. So, what we did was incorporated those physiotherapy exercises as well as my own personal training exercises. And then her goal was also to work on weight loss, which would also help with her ankle because the more weight you're carrying, the harder it is on the joints and ligaments and things like that. So we did a lot of unilateral movements, cardio, strength training. And, because she broke her ankle, there's a higher chance of re-injury. So that was also something we were working on to prevent.
Mm-hmm. Mm-hmm. Um,
So in terms of strengthening, sorry to interrupt. Do you feel like clients strengthen muscles as well with physiotherapy, or is it more so just rehab that you guys do?
Yeah, no, that's a great question. So the way that I like to practice is I typically like to target those like more deeper, more stabilizing working muscles, as opposed to kind of like I'll call them like maybe the showy offy muscles.
Yeah.
So I'm not here to give you abs. I'm not here to give you bigger biceps. But what I want to do is I want to strengthen. I want to activate those deeper muscles so that when you do want to strengthen those more superficial muscles, you won't be in pain. I'm all about finding what are the muscles that are working too hard, what are the muscles that are not working hard enough. So when I'm giving exercises, I'm giving exercises specifically to those muscles that aren't working hard enough, for example, instead of kind of doing like the whole body, right? But I like to complement my therapy too with some modalities. So sometimes I'll use some suction cups, I'll use some acupuncture, just to use on those muscles that aren't working, just on those muscles that we need to relax, right? What do you feel like your role in strengthening is?
So I guess my role in strength training is like their overall. So you know how you're saying you focus on the smaller muscle groups. I'm definitely focusing more on the bigger. People come to me because they want those abs, they want those biceps. But at the same time, I will focus on smaller muscle groups if I notice it's getting in the way or preventing them from doing larger like movements. So for instance, I had a client who had a rotator cuff injury, and that was stopping them from being able to do other things. So what I would do is still focus on doing those exercises, give it to them for their homework, but then the majority of the workout would still be them working on their abs, getting those strong biceps, legs, things like that. And we have a mutual client who has MS actually, and we work together to help them, to help him manage his MS. So I think that's great because then what you can do is specialize in what you do best, which is the muscle stim work, and you do all the, and I do the low impact stretching and mobility. And I think that's what works really well together. And you mentioned that, you'll focus on the superficial muscles, what muscles are working, too hard and then not hard enough. You did the same thing with me when I went to you for treatment. So I remember that exactly. I think my glute wasn't working as hard as it could. So you're great at focusing on things like that. And I think that's why our partnership is so great because, we kind of balance each other out. So I do things that are out of your scope of practice, such as, doing the measurements, progress check-ins, weightlifting, nutrition, how much weight was lifted in the previous exercises. And then you do, the acupuncture, suction cups, the stem or the stim. See, I'm not even saying it right because I don't use that stuff. So yeah, I really think we balance each other out, and our clients clearly love seeing us work together because it works for their benefit every time.
Mm-hmm, mm-hmm. No, and you know what? I love it. I love being able to work together, and it's like the progress that we see working together is just phenomenal. And I've heard all about your structured exercise programs, like the exercises. I've seen the exercises you give your clients, the tracking of the sets and the reps. It's all phenomenal, and clients, they love seeing their progression in this style that you've created. So I'm always so blown away by hearing about how excited clients are with your programs.
Oh, you're so sweet. Yeah, my clients love working with you too. I feel like we're just here gushing over each other. Yeah, so I had someone who was interested in actually personal training and they had reached out to me, but I was like, you know what? It doesn't seem like you're ready right now for personal training, especially in your current condition. I don't feel 100% comfortable. So I recommended them to you and they just right away noticed the difference and they loved how knowledgeable you were and how much their condition improved. So from there, I jumped in once, you got a little bit stronger with you and we did personal training and then everything's just worked out ever since. So I guess with this, I'm just wondering, both you and me are getting by day working together and our clients are seeing that. And have you noticed any differences from like what your clients have said? Anything about, specifically them wanting to maybe incorporate more strength training into their physio routines or anything like that?
So do you mean like specifically the clients that we share,
Yeah.
or do you mean? Yeah. Oh, yeah. No, I'll have kind of clients come back after a session after seeing you, and they'll be like, "Oh my goodness, so like, can you notice the weight loss?" And I'm like, "I can. That's phenomenal." And like, I don't know if I guess we didn't mention it yet, but like, weight loss also has a huge role in pain too, right? So like, if you're helping with weight loss, well, now that's less load and less pressure on the knees, on the joints, right? So just having that factor too, since I don't do weight loss, and since you're also helping me reduce that pain faster.
Yeah.
So it's such a great partnership, and I get, like I said, the patients come in and they're so excited. They're like, "Do you see this? Do you see this? This is what's."
Well, I have to interrupt because like that one client we shared together as well, she was having so many limitations like on her right side just because she had some muscle imbalances and maybe who knows a previous injury that she didn't realize flared up again. Like so anyways, we were limited in some of the exercises we did. And then after she saw you and she continued to see you, then we were able to do more. So it just transfers right over the things you're doing as well. So it's perfect.
I love it. Oh, I could talk about this partnership
Yeah.
all day. It makes me so excited.
Me too.
I guess we probably should cut off. I honestly, I could keep complimenting you all day, but I guess maybe we'll stop there and ask if anyone has any questions. We're gonna kind of like slowly just start wrapping up. So if someone wants to like type something in, we can answer it while we're still talking.
Yeah.
Um, but we hope we answered some of your questions about the similarities and differences of personal training.
Hmm.
And then,
Yeah, I guess we'll
yeah,
see. I don't see any questions so far. So just want to add in a side note, because I hear this from physiotherapists as well as massage therapists. Like, you don't want to just wait until December to use up all of your benefits. And I'm sure you agree, Veronica. So my recommendation is to see a physiotherapist before then. And especially if you're training and doing, exercises or you have a personal trainer yourself, try to incorporate that in because it's really going to complement your exercise program, your exercise routine. And yeah, that's what I have to add in there.
well, and I guess on another note too, a lot of people do like New Year's resolutions, but you don't have to wait till January 1st to start your weight loss or fitness goal of New Year's resolution, right? You could start now.
That's
You can
true.
start.
Yeah.
So, we don't see any questions here, but if you guys want to reach out, you can ask us any questions. And
Oh, that's
oh,
so
thanks so
sweet.
much. You guys are great. Thanks. We love the comments. um, guys have any questions, feel free to reach out to us. If you want to know how do you work with a physio, or if you want to know how to best work with a personal trainer, or if you want to know how to best work with the combination of us, definitely feel free to ask us any questions.
Yeah.
And we're going to repost this. This is going to be on both of our Instagram accounts. So if you want to rewatch it, or if you want to send it off to someone who you think would benefit from knowing any of the information that we talked about today, feel free to reach out to us. Oh, thanks so much. We love the comment.
Yeah, you're so sweet. Thanks for joining us, everyone.
Yeah, thank you guys.
Okay. Bye. I don't even know how to end this thing. Oh, there we go.